I feel a little bit put out by the first speaker, Konstantinos, because he was looking at safety too, saying we should look at what we're doing good rather than what I'm about to present, which is using cloud-based applications in my hospital for looking at when we don't do things so well. However, I would like to just put a quick kind of footnote at the start, and that is we implement for the last 2 years a patient safety framework called Team Steps. And across the hospital, we, as part of Team Steps, one of the tools or techniques is called the debrief. And at the debrief, we ask 2 simple questions. What did we do well? Always the first question. And the second question is then, unfortunately, what can we do better the next time? So just to kind of contextualize what I'm going to present, it appears maybe on the face of it that we're looking at when things go wrong so that we can learn. But because we want to be data-driven in my hospital, that's one of the key data. But I'll also show you, hopefully, linked to patient safety, what we're doing to learn from what we do right. Plenty of acknowledgements there. Thanks to all of these people, especially a shout out for Professor Shane Higgins, who gave me permission to be here today. But most importantly to my wife, Kira, who is my inspiration. Long suffering because she's married to me, not because she suffers from a chronic illness. If you're looking at where this links into our conference objectives, I think that it's linked to certainly emphasizing the importance of proper patient safety management. And I think that what I'm going to show you is what our hospital believes to be a patient safety management system, specifically a subsystem which is allowing for data management. And we have found in our hospital that as a result of bringing people along, and you could ask many in our hospital, and they can't imagine what it would be like to now try and deliver our services without Zoho, which is the application we use. I think it probably contributes to rather than necessarily empowers a safety culture. That's where I work, the National Maternity Hospital. By birth rate, the largest in Europe last year or the year before. Tertiary referral centre for all sick babies. We treat, we teach, we research. And we're led to believe, although there's a general election in Ireland in the next few weeks, that we're going to, in about 5 to 7 years' time, move to an amazing new facility, which will be a co-location with an acute hospital, especially an emergency centre. And where we've arrived to today is because when I was recruited 5 years ago, my clarion call was, we want to be data-driven for patient safety so that we can make fact-based decisions for our patients, for our staff, for our health service. So what are we using? After a lot of research, around about 18 months, trying to find something that would allow us to collect and analyze data simply and easily with an easy-to-use interface, we came upon a product called Zoho Creator. Zoho Creator is a secure permission control cloud-based application, which immediately meant that it doesn't matter where you are in the world, what kind of a platform you have, even mobile phones. I can check Zoho on my mobile phone. We can get into our data. It's real time. So as soon as any data in any of the apps I'm going to show you, it's immediately available. There's 2 types of apps, if you will. There's the apps where the creator builds and designs and develops, and then when they're published, they become customer portals for our app users. And each app contains 3 core components. The forms, which we all know from web-based forms to collect our data. The reports that can be text reports or data visualization, which we publish internally and soon to publish externally. And then we can also create pages which will allow even our public and our patients, as we push towards open disclosure and transparency in health services. That's just a snapshot of the applications that we've built. I'm going to have a look at a few of them just to show you the screens. But now more and more we're being embraced. And in fact, on Friday, we launched the user acceptance testing of our fetal medicine management system. And what we're finding as well is that now the data that's being collected and analyzed and managed is not only being reported and contributes to decision making across all of the levels of governance in my hospital, right up to the hospital board, because we're a voluntary hospital. But also we're finding it's now being used in research. It's being used in presentations and write-ups around research. I'd like to leave you, as I finish all of my presentations, with a very famous quote from the guru in my world. These systems and everything are brilliant, but the bottom line, my friends, is that you need love for your patient and love for your profession. If you're uncomfortable with love, I would substitute it for passion or respect. My name's Luke from the National Maternity Hospital, Dublin, Ireland. Thanks very much.